As the IDF pushes forward with operations in Gaza, they're once again calling on citizens to evacuate from a small portion of the designated humanitarian zone in Deir al-Balah. The reason being, the Hamas terror group is once again embedding itself in civilian populations, complicating not only IDF efforts, but also those of humanitarian groups.
So the humanitarian zone declared by Israel has shrunk. It's now about 11% of the entire Gaza Strip. And this isn't 11% of land that is fit for habitation, fit for services, fit for life.
The United Nations says they've relocated their main operations to Deir al-Balah in recent months, and the new evacuation orders brought operations to a complete halt on Monday.
The humanitarian operations are also being displaced within these evacuation orders, and the humanitarian response here is being completely strangled and limited to our ability of what we can do.
Yet they still have a major operation set to kick off on Saturday. Israel's coordination of government activities in the territories, COGAT, helped deliver enough polio vaccines for 1.2 million people this week, after a 10-month-old baby contracted the first case of polio in Gaza in 25 years.
Over 3,000 people in total will be working on the campaign, over 1,000 of them drawn from UNRWA, which is essentially the largest primary healthcare provider left in the Gaza Strip. The vaccines have come in. We're calling for calm. We're calling for humanitarian pauses that will allow the vaccination programs to pass and be implemented successfully.
UNRWA is calling for a polio pause in the fighting so they can safely deliver aid. But this is the same organization who has employees with ties to Hamas, some who even participated in the October 7th massacres. The IDF already has routine humanitarian pauses and argues those should be enough for civilians to reach medical centers and receive the aid they need, as long as humanitarian groups keep operations up and running.